Welcome. My name is Peter Strong, and I provide Skype therapy for the treatment of anxiety and depression and other emotional problems, also including help with recovery from addiction. So Skype therapy is a very good choice if you're looking for an alternative to working with a therapist in person. Sometimes it's just not possible to find a therapist in your local area, or you may be living abroad and don't have access to therapists. Very often I work with people who suffer from agoraphobia or have a driving anxiety and are unable to travel to see a therapist in their office. So there are many reasons for choosing Skype therapy. Many people like Skype therapy because it's more comfortable. It's certainly a lot more convenient since you can conduct your sessions at home or at your place of work without having to travel to an office. And many people like it because it's just a lot less clinical in nature. So the approach that I take is called mindfulness therapy, which is really about giving you the tools for working with your emotions, giving you mindfulness methods for working with anxiety and depression to heal the internal process that is causing your anxiety or depression. So this is quite different than conventional counseling, where you would just talk about your feelings and spend a lot of time analyzing your feelings and your family history and so on. In my opinion, that's not a very good approach because it doesn't really address the underlying cause, the mechanism that is causing your emotional suffering. And the same goes for medications. Medications may make you feel better for a while, but they don't really change anything psychologically at the core level. So the moment you come off those medications or that they lose their effectiveness because your body gets used to them, then eventually you're back where you started from with the same amount of anxiety or depression. Sometimes medications can make things worse because you're really avoiding the underlying cause, and so that is not addressed, and it simply gets worse over time. It's much better if you put your efforts into looking at the mechanism that produces your emotional suffering. You have to look at how that works and then help change that inner process and heal the inner wounds that are not healing properly. So the real issue here is to look at your anxiety or depression directly and see what is happening in the mind. For example, to look at the array of habitual reactive thinking and beliefs that surround your anxiety or depression. The real issue is actually not the thoughts or beliefs, it's the fact that we become blindly identified with those thoughts and beliefs. this blind identification is what gives power to thoughts. So that's an example of cognitive reactivity. We can also discover how we feel about our anxiety or depression, and often you'll find layers of emotional reactivity towards your anxiety or depression. There's often layers of emotional reactivity within depression or anxiety. It's actually a constellation of other emotions that we don't usually see. So the real problem is reactive identification, which ignites more suffering and prevents us seeing the deeper structure of your anxiety or depression. So in mindfulness therapy, we spend very little time talking about our emotions and a great deal of time looking at them directly through the process of mindfulness meditation, where we hold that emotion in our mind and observe it, meditate on it, and develop that non-reactive relationship that allows us to see clearer what is going on in the mind, to look at those patterns of reactive thinking and emotional reactivity, and also behavioral reactivity, the ways that we try to distract ourselves or avoid the emotions that need healing. There's lots of different layers to mindfulness therapy, but the primary message here to understand is that the way to facilitate healing is to establish a direct conscious relationship with your emotions. So in mindfulness therapy, we do this by meditating on our emotions. When you see those reactive thoughts, they are no longer able to operate blindly. The very act of bringing them into consciousness takes away their power. You are now training with your emotions and with those reactive thoughts in a way that frees you from those inner psychological habits, which is the real cause of your anxiety or depression. It's what is actually happening in the mind that you have to look at and change. And the best way to change it is by making it conscious. There are other things that we can do to increase healing, such as developing inner compassion. So instead of reacting emotionally to your fear or sad feelings or guilt or shame or whatever emotion it might be, instead of reacting to it, we respond to it with compassion. So this is a way of bringing more consciousness to that emotion to help it heal. And that stops feeding the underlying emotional pain, and instead it promotes healing. So inner compassion is a very, very powerful force that we develop during mindfulness therapy when we are learning to meditate on our emotions. The purpose of meditating on our emotions is to develop this inner compassion and to see more that needs to change. So there's lots of different ways we go about doing this, but that's just a brief introduction to what I teach during Skype therapy sessions. This approach is very effective, and most people see substantial improvements within a matter of a couple of weeks when you learn how to do this yourself between sessions, how to meditate on your emotions, to develop more conscious awareness of those blind habits, and then to develop inner compassion that facilitates healing, you'll see improvements very quickly. So if you'd like to learn more about this process of doing therapy through Skype and using mindfulness to heal anxiety and depression, then please contact me and we can schedule a Skype therapy session. Thank you.